transitioning to live with COVID. The mask wearing, the testing and quarantining are all part of the transition period to when in coming months at the appropriate time we'll be able to live our lives more normally without these measures being in place. Importantly, as we transition, it's important that we keep following the rules, the social distancing, the mask wearing rules, and that we keep vaccination rates high. It is our best defence, and we need to ensure that we get vaccinated when we are due. I know that some people remain anxious, but I've been out and about in the community over the last week, and I know that people are starting to return with more confidence to shop in retail settings, to go to their favourite hotel or their favourite restaurant. You know, I was there at the cricket on the weekend and watched people, thousands of them, enjoying themselves, you know, mainly and in the main in a COVID-safe way. And it's pleasing that people are starting to return with cautious confidence to their lives as they know them. Now, while we're still seeing active cases each day, it's important to put some context around that metric as well. As of today, we have more recoveries from COVID than we do active case numbers. And for every positive case that we currently have at the moment, more than 2 people, more than double, have recovered from the disease already. With a further 1,258 recovered as of today and released from isolation today, we now have 13,672 people that have now recovered and are out of isolation. As of today, we have 1,310 new cases for a total of 6,417 active cases currently isolating. So more than 13,600 people that have now left isolation and have moved through that period. 6,417 active cases currently isolating. We have 25 people in hospital with COVID, but only 12 that are being treated specifically for COVID. And this includes 2 people in the ICU, and Catherine Morgan-Wicks will provide a little bit more of an update on those in a moment. In terms of testing, we have plenty of both PCR tests and RAT tests available. And right now, if you are symptomatic or a close contact of a positive case, testing has never been more accessible. Yesterday, there were 2,256 PCR tests conducted and 4,676 rapid antigen tests distributed. Of the rapid antigen tests distributed yesterday, more than 600 were delivered directly to the doors of people living in either regional or remote areas, or those that couldn't access transport for some reason to go and collect them. So if you're symptomatic or a close contact of a positive case and require a RAT, please register your details either online via the coronavirus website or call the public health hotline. You'll be given details of where to collect a RAT at a distribution hub, or this will be couriered to your door if you are in a remote or regional area, or if you are unable to collect that yourself because of some other health concern or a disability, or even a lack of transport. The feedback is broadly that the system is working well. It's alleviating queues and ensuring that those people who need a RAT are able to get them and receive them free. I want to just quickly touch on the Mersey Hospital, and Catherine will say more about this in a moment. I'm advised that overnight the Mersey Hospital is investigating a situation in which 2 patients have tested positive in a ward, and investigations are underway regarding the transmission source, and contact tracing is being conducted at the moment. As I've said, Kath will provide more details in a moment. Now, I want to just deal with borders. When we announced that our borders would reopen, we put in place a testing requirement to require a negative test prior to arriving in Tasmania. At the beginning, it was a PCR test within 72 hours, and then that's pivoted to a RAT test within 24 hours. We said that this would remain in place for at least a month as part of the transition plan that we were on. As at midnight tonight, I can confirm that there will be changes to our travel arrangements at the borders in line with that commitment. Vaccinated travellers will no longer be required to register their travel or to take a COVID-19 test prior to travelling. However, the rules will remain in place for those who are not vaccinated, and they'll remain the same unless you have a valid medical exemption. So this means that only travellers who are unvaccinated, aged over 12 years and 2 months, must register their travel on Tassie Travel from midnight tonight, and they must have a negative RAT test within 24 hours of coming to Tasmania, or conversely they can take a PCR test if that's available to them within 72 hours prior to travelling. Upon arrival in Tasmania, the requirements still remain the same for unvaccinated travellers. If you arrive, even if you've been tested, you will still be required to do 5 days quarantine as an unvaccinated traveller, with a need to produce a negative test on day 5 to leave quarantine. Now, we will review this as we transition through this phase, and we'll keep that under advisement over the next month. However, it's an important step, and I want to explain why we're leaving that in place. The main metric is protecting our health system, and while we're not seeing the numbers in hospital that other jurisdictions are, principally as a result of the higher vaccination rate that we've got across the community, we do know that the evidence in other states, such as Queensland for example, demonstrate that unvaccinated people are up to 24 times more likely to end up in an ICU than someone who is vaccinated. And that's why that particular border measure regarding unvaccinated travel will remain in place for the moment. Now, in regard to vaccinations, I encourage everyone due for their booster to please get it. Even if you've had COVID, make sure you get your booster once your symptoms have gone and within 6 months after you've recovered. To date, 94% of Tasmanians aged 12 and over are fully vaccinated with 2 doses, and around 50% of those currently due for a booster, around 50%, have received one. Now, this equates to more than 26% of the eligible population aged over 18 years now having had their booster. I want to strongly encourage parents of school-aged children, aged 5 to 11, to take up the opportunity for their child to have at least 1 dose of the vaccine before school returns. But again, as we've said previously, this is not mandatory. However, the evidence is, and it is very clear, is that children overwhelmingly have much milder symptoms. However, I do strongly encourage parents to get their children vaccinated. It is the best defence. And so far, around 50% of eligible children have been booked in, and around 28% of children aged 5 to 11 have now received their first dose out of that cohort, and we have plenty of vaccination opportunities available before we get back to the school year, and Catherine can provide a bit more detail in a moment. Now, in terms of school, like me, parents right around the state are preparing their children to return back to school in February. Now, I want to be very clear, as I've said on a number of occasions, our schools will reopen on the 9th of February. Returning to face-to-face learning is a priority. Tasmania is finalising its COVID education plan based on public health advice, and this will be discussed at National Cabinet on Thursday. This plan has been under construction now for a number of months. I note that some other jurisdictions have already announced their plans, but I want to make this point. We start on February the 9th. Other jurisdictions start earlier than that, which is why they are talking about these plans now. At the end of this week, we'll provide further detail to parents, to school communities, to our teaching cohort, to ensure that people understand very clearly what the arrangements will be. Measures have already been undertaken to create COVID-safe learning environments. We've conducted the audit already in terms of schools, in terms of ventilation, in terms of the need for air purifiers where they are required, and that work will continue. Importantly, as we move forward, all responses to outbreaks will be proportionate and informed by public health advice, and the well-being of children and education staff will be supported to ensure and enable the delivery of a quality education as we return. The department will work closely with parents, principals and schools to help them best prepare for term 1, and as I've said very clearly, at the end of this week we will announce our plan to return, and obviously we will remain informed as other jurisdictions go back to school, and if there are any learnings as we move forward, we will draw from that as well. We have the benefit of starting later than those other jurisdictions. Now, finally, I just want to thank all Tasmanians at this time. I know this is challenging, and I can understand that some people are anxious. But as I've said, we need to go through this transition stage. This is not living with COVID. We need to transition to where we can live with COVID, where we can deal with COVID in the same way that we deal with other respiratory diseases that impact us on an annual basis, such as the flu. And importantly, we will get to that point. For Tasmanians, it's important that you do the little things. Stay home when you're unwell, just exactly as you would if you had the flu. Wash your hands, cover your coughs and sneezes. Importantly, get your booster when due. And if you're not vaccinated, and I want to make this really clear because the evidence that we're starting to see from the other jurisdictions quite clearly indicates that being vaccinated is your best defence. If you're not vaccinated, please speak with your health professional, get some advice, and please get vaccinated. It's the best defence that you've got. Don't listen to the rubbish that we see on social media. Speak to your health professional and be fully informed in terms of your decision. Now, we'll get through this transition stage, and as I've said, it's at times it can be awkward and people can be anxious, but we need to transition to a point where we can live with COVID. Where we're at the moment is not living with COVID, it's transitioning to that phase, and over coming months we will move into that living with COVID phase where we treat COVID in exactly the same way that we would treat other respiratory diseases like the flu. I'll hand over to Dr. Beach.
Thank you, Premier, and good morning. I'll just say a few words about the recent cases, and in particular the cases who've been hospitalised. You heard from the Premier that today we had 1,310 new cases diagnosed in the 24 hours to 8 o'clock last night, of which about 3/4 were diagnosed by rapid antigen tests and around 1/4 by PCR tests. And we've seen numbers have fluctuated around 1,000, 1,300 for much of the past week. We now have 25 cases in hospital. It's expected that as we progress through the epidemic, there will be a slow increase in the number of hospitalised cases, particularly when there's a reasonably high number of cases in the community. It hasn't been a dramatic increase, it's been a slow, steady increase, and of course some people have left hospital. So currently there are 25 people hospitalised, 2 of whom are in intensive care and 1 of whom is on a ventilator. What that represents is around about 1 in 250 cases being, 250 active cases being hospitalised, which is pretty similar to the Australian proportion. It's a little bit less or fewer people than the Australia as a whole. And around about 10% of people who are admitted to hospital nationwide are in intensive care units. In Tasmania it's around 12%, so again fairly similar. I said last week I thought it would be useful for Tasmanians to understand the age range of people in hospital, and I can provide that today. We're looking to provide this around about once per week. Because when I start to talk about cases in hospital or in intensive care, I'm talking about small numbers. I can't go into much further detail about each of those categories simply because it would become more identifiable of the people involved. But the age range I think is helpful. We have 1 person in hospital aged less than 10 years, no one in hospital aged between 10 and 19 years, 2 people in hospital in their 20s, 4 people in hospital in their 30s, 2 people in hospital in their 40s, 1 person in hospital in their 50s, 2 people in hospital in their 60s, and quite notably 7 people in hospital in their 70s and 6 people in hospital who are in their 80s. So that means that just over half of the people who are currently hospitalised in Tasmania are aged 70 years or older. We have vaccination data on some but not all of the cases at the moment. Data are collected progressively, and I think the important fact here is that of the people in hospital, only 4 of them have currently had the 3-dose schedule that includes a booster. And I think this is important evidence that supports the findings of other jurisdictions that booster vaccinations are very important for keeping people out of hospital. So it's very important that people who are eligible for their booster get those, book in to get that as soon as they become eligible. I might just leave it there.
Any new exposure sites of concern?
I think I've explained a couple of times that because with 1,000 people a day being diagnosed in Tasmania and each of them going to numerous kind of locations while they may have been infectious, there are potentially anywhere in Tasmania could be an exposure site. So the message to the Tasmanian public is if you're out in public, take COVID safe precautions. If you're out in public and you get symptoms, get tested.
Tasmania has hit the peak of the COVID wave yet?
We've had a bit below or a bit over 1,000 cases for a week. So we're currently have got a fairly steady plateau, if you like, of case numbers. We would need to see case numbers come down successively for a number of days before I could confidently say that we were on the way down from this peak. So we're not quite at that point yet.
And definitely not for hospitalisations, then by the sounds of things you're still expecting that to be going.
We would expect further hospitalisations in the coming days, because it's been the experience of every jurisdiction that even when their case numbers plateau out, with the passage of time, a number of those acute cases get sick enough to need hospitalisation. So that's what our system has been preparing for.
What proportion of cases do you believe are getting identified in the community? Do you believe we're getting them all, or is there a proportion you think are going unnoticed?
When you have a respiratory illness that has a spectrum of severity, from severe that brings people to hospital through to mild that people may barely notice, there's always underdiagnosis of the mild cases. We know that every year in Tasmania there could be 50,000 cases of influenza, many of them mild, but we only get notified each year 3,000 to 4,000, so less than 10% of influenza cases are notified. I think in the case of COVID, because it's a prominent illness and people are actively looking to diagnose cases, even mild cases, we would be doing better than we normally do for flu in picking up cases. But I'm sure that there's at least as many cases that aren't diagnosed as cases who are diagnosed.
We know that if Delta is circulating in Tasmania?
The most recent data that we had from the laboratory was that all of the tested isolates were Omicron.
I don't know if you'll be able to help on this, but there's an aged care report, a federal aged care report from the end of December, which records for the first time 2 deaths in a Tasmanian Anglicare home that weren't on the previous reports. Are you able to shed any light on whether they're new or they're from the Northwest outbreak and the data's just...
I can't shed light on that. We have a established process for attributing a death to COVID. If a doctor who's looking after a person says that they have died of COVID, or COVID is a significant contributor to their cause of death, or if a coroner makes a determination that COVID is the cause of death, they're counted as COVID-related deaths in Tasmania. I'm not aware of such deaths that have occurred towards the end of last year or more recently.
And if there were deaths in an aged care home in Tasmania, they'd be reported by, in the daily figures, would they?
Our daily figures follow the protocol that I just described to you of attributing deaths to COVID, and we report them.
And what assistance is public health giving to the aged care sector in Tasmania?
The response to the aged care sector has been planned for many months. Back in 2020, we were actively managing exposures that arose at the tail end of the Northwest outbreak in aged care. And it's a very collaborative approach. It's involved a lot of planning, a lot of training of aged care facilities to be ready to manage cases with isolation and heightened infection control precautions and testing. So public health has been involved in that, but there's an aged care emergency operations centre that becomes involved. There are links to the Commonwealth who are involved in outbreak management meetings and the provision of PPE, and there's a private testing service that goes in and tests residential aged care facilities. So there's a really quite coordinated approach to try and minimise the impact of COVID in nursing homes, residential aged care.
And has the Tasmanian authorities been providing rapid tests to homes yet?
Look, I can't talk about that at an outbreak by outbreak level. The principal approach has generally been to use PCR testing through a private laboratory service, but I expect that we'll be transitioning to use more RATs as time goes by, because that's a more straightforward and immediate process, but I can't talk about it outbreak by outbreak at the moment.
And possibly a bit early, but has there been any, significant transmission identified at the cricket?
I'm not aware of any cases that have been attributed to the cricket. There were, I think, over the 3 short days, really, short test match, 20,000 or 25,000 people. There are sure to be cases of COVID that were transmitted at the cricket, just as there were in the Tasmanian community more broadly. And I think it would be very difficult to identify whether someone got it at the cricket or got it in their workplace, or whether they went to the supermarket.
So what's a super spreader event? How would we know?
if we saw a conspicuous linkage of cases back to the cricket. Tasmania at the moment is at a relatively high level of community transmission. We're seeing community transmission occurring at a rate similar to, as I think I've said before, South Australia, Queensland, the ACT, not quite as high as Victoria or New South Wales. And so there's thousands of transmission events occurring every day in Tasmania. There has to be, for there to be 1,000 cases a day in Tasmania. I think that the focus on the cricket is, well, the cricket was an event which a good proportion of people wore masks. They were asked to be vaccinated before they attended. It wasn't an unduly packed event. From my glimpses of it on the television, people were actually reasonably well spaced out. So of course there'll be transmission there, but I don't believe it would have made a significant contribution to how many cases there are in Tasmania right now or in a week's time.
How many numbers on workplace with close contacts that have applied for the exemption status yet?
I didn't quite catch that.
Do we have any numbers on workers with close contacts that have applied for exemption status?
Premier may have those numbers.
I just had one more question for Dr. Beach. Is there a breakdown of those that are being admitted to hospital with unrelated medical conditions that are testing positive to COVID?
I don't have that with me. I don't know whether Kath does. I mean, it is always the case when there's a lot of COVID in the community that a number of people will have incidental COVID because they're tested for it when they go into hospital. The important thing is whether or not they're in hospital because they've got COVID. That's really the main impact of COVID in hospitals. But of course, if you identify someone who incidentally happens to have COVID when they've come in with a broken leg or some other condition that requires care, it's important to wrap the appropriate infection control around them.
Good morning everyone, and can I say it's great to leave isolation and join the over 13,000 Tasmanians that have now safely recovered from COVID-19, and I'm really grateful for the fact that I experienced a mild illness, and which I really attribute to my full vaccination and booster dose. So really, from my own personal perspective, to encourage all Tasmanians to please get fully vaccinated and get your booster as soon as it's due. So today I'll provide an update on testing, our hospital services and vaccination. If I start with testing, we're continuing to see strong testing numbers across the state, as evidenced by over 2,256 PCR tests through the laboratories and our rapid antigen test distribution numbers and 950 positive RATs reported. Over the last 24 hours, we've distributed 4,676 RATs through our click and collect distribution sites across Burnie, Devonport, Launceston and Hobart, and this includes 631 that were sent to rural and regional addresses or to people that are unable to travel to a collection site yesterday. Now, it's important to note that our PCR testing is not stopping. We now have capacity for between 4,000 to 5,000 PCR tests a day, together with our rapid antigen test distribution sites. And considering that they have handled over the last fortnight between 5,000 and 15,000 rapid antigen tests being distributed each day. Now, if you're symptomatic or a close contact, you can choose to access PCR at a state clinic, which has availability at the moment on the same day. So you can receive then a result from a state clinic within 24 to 48 hours, with most averaging around 24 hours at the moment. So please hop online to request a PCR test or call the Public Health Hotline, and you can also hop online and call the Public Health Hotline to request a RAT. Now, I note that we have received feedback about some delays in receiving PCR test results from private pathology providers in the state. We are working with the private providers to try to shift load wherever we can, including shifting the Burnie testing clinic samples to the Royal Hobart laboratory for processing, so that we can try and improve that northwest turnaround time on PCR tests. And DPSL this morning have confirmed current turnaround times being brought down to 24 to 48 hours, but we'll continue to work with those private pathology providers as best we can. Now remember, if you choose to use a rapid antigen test and test positive for COVID-19, it is critical to complete your details in the rapid antigen test declaration form, which is found on the coronavirus website. Registering your RAT will allow Public Health to contact you with further information and advice on isolating and how to access medical assistance with our COVID at Home program. In terms of supply, we currently have over 360,000 rapid antigen tests on hand for health purposes in the state, and we are expecting, in terms of our next delivery, of approximately 500,000 rapid antigen tests in coming weeks. And I'll just note, in terms of that question to Dr. Veach of the supply of rapid antigen tests to residential aged care facilities, we have been supplying residential aged care facilities in the state with rapid antigen tests and also PPE, and that has been done via the request of the Commonwealth, who will then replenish our state supplies from the national stockpile. If I go to COVID at Home and community case management facilities, we currently have 387 cases enrolled in the COVID at Home program, with the majority experiencing mild to moderate symptoms. And if you wish to enrol in the COVID at Home program, it is critical that you complete the survey, which is sent to you via SMS within 24 hours of your positive result being reported to Public Health. And we'll ask you questions in that survey about your health and any conditions that you might have that would place you in a higher triage category and enrol you in COVID at Home. And we'll also ask if you want to opt in or out. So please do think about your personal health circumstances and answer that survey, and do opt in if you have any concern in relation to COVID at Home. We'll also give you the 1800 number. So if you do opt out, you can still ring the 1800 number and ask any questions about the symptoms that you're experiencing. We've had 64 people successfully discharged from this program within the last 24 hours, and for those that can't isolate at home, we have 40 cases currently in our community case management facilities, with one discharged in the last 24 hours. On our hospitals, the Royal Hobart Hospital, Launceston General Hospital and North West Regional Hospital remain at pandemic response level 3, with the Mersey Community Hospital currently at level 2. In our public hospitals, we have 25 current inpatients, with 12 being treated specifically for COVID symptoms and 13 cases being treated for unrelated medical conditions. And on that previous question in relation to the reporting of COVID cases in hospital, we report a total, so all patients that are detected with COVID are reported in our daily totals, and then we provide you with that subtotal for those that have unrelated symptoms. So we have 20 patients currently in the south, 3 in the north and 2 in the northwest. We have 2 patients that are receiving ICU level care, and one of those patients is currently ventilated. So that's a total of 2, including 1 that is ventilated. And our ICU patients are both in their 70s, and while I can't comment on their individual medical history, I can say that one is stable and one is not stable. Currently, we have approximately 143 healthcare workers testing COVID positive, with around 260 reporting as close contacts, and with 396 close contact exemptions that have been granted to date by our regional health commanders, subject to the strict conditions of daily testing and PPE. So in terms, if I move to the Mersey Community Hospital situation, we are currently investigating the case of 2 patients in the Mersey Community Hospital that have tested positive in our medical ward. Now, this is a ward that is situated on the 3rd floor of the Mersey Community Hospital. The patients had been in a 4-bed room in the medical ward. A patient in their 60s was found to have symptoms and was yesterday tested via a rapid antigen test and found to be positive. This led to an immediate response under our outbreak management protocol, but I note that it is not yet an outbreak, but we are handling our response under that protocol. So 3 other patients were in the room with that patient. 1 has tested positive, which makes the 2nd case. 1 has tested negative, and 1 was discharged. So they have been contacted, they've isolated and are being tested. So in terms of the 2 positive rapid antigen test patients, they have since had rapid PCR, which has also confirmed the positive diagnosis. Staff contact tracing has identified no staff who would classify or be categorised as close contacts, And I note that in all clinical areas of the Mersey Community Hospital, N95 masks and approved eyewear have been mandatory in all clinical areas since we moved to statewide level 2 on the 31st of December. So as I noted, the Mersey is not in outbreak, but our response is guided by our THS Northwest Outbreak Management Protocol. The original patient was immediately moved to a negative pressure room when detected, and since both the two positives have now been moved to the Northwest Regional Hospital, which is in line with our COVID management plan. We are not accepting further admissions to or transfers from the ward at the Mersey, and the ward is closed to visitors until the situation has been fully investigated and assessed. 5 patients have been identified as close contacts, having shared a room with the patient who had been in hospital for some time. All have been discharged and all have been contacted, told to isolate and follow testing and public health advice. So in terms of our staff members, while no staff members have been identified as a close contact, an appropriate PPE has been worn throughout with no identified PPE breaches. We will be undertaking rapid antigen testing on all staff in the area as a matter of precaution. And we'll also be reviewing the visitor log for the last 72 hours. So further information will be available in relation to the Mersey this afternoon, and we'll also have further information flowing through to our staff. If I can go to the City Hall announcement, as part of the Department of Health's COVID-19 pandemic plan, the state government and the City of Hobart Council have reached an agreement to make the City Hall available as a contingency for outpatient treatment spaces for our COVID-19 positive patients. Now, City Hall was previously used to conduct respiratory outpatient clinics back in 2009 during the swine flu epidemic, and has remained as a contingency in pandemic planning since that time. Now, the agreement will allow the Department of Health to prepare and set up facilities to conduct appointments for people who have tested positive and require a face-to-face appointment, and it eliminates then the need to attend the Royal Hobart Hospital. COVID-19 outpatient appointments are currently conducted within the COVID-19 ward in K Block at the Royal Hobart Hospital, as there is currently available space due to the lower levels of COVID-19 admissions. City Hall will be stood up if the COVID ward space is required, so if patient admissions do increase for overnight admitted patients. Now finally, on vaccination, as of Sunday the 16th of January, close to 98% of Tasmanians over the age of 12 have had 1 dose of the vaccine, and more than 94% are fully vaccinated. And over the weekend we passed 1 million vaccine doses given since the start of the rollout, including over 100,000 boosters. And I think if anyone is involved across the healthcare community to think that we would have delivered over 1 million vaccination doses for a particular virus, it's just an amazing thing. So last week was also the biggest week of the entire vaccination rollout to date, with more than 48,000 doses given in Tasmania, at pharmacies, at our GPs and in our state-run clinics. And I really do thank everyone for their hard work involved in vaccinating Tasmania. For our 5 to 11s, the first week of clinics for children saw a fantastic response. While Commonwealth figures show us overnight at 20.7% of 5 to 11s receiving a first dose of vaccine, our internal figures show that Tasmanian 5 to 11s are at 27.6%, which is one of the best rates in the nation for this age group, compared to a national average of around 14%. We are also continuing to see strong bookings, with 48% of the eligible group already vaccinated or booked into future state-run clinics, and this figure doesn't include our GP bookings. So to parents who haven't already done so already, please book in at one of the dozens of specialised paediatric clinics that are running before the end of the summer holidays, and you can also contact your GP directly to make a booking. And last, on boosters, approximately 27% of Tasmanians aged 18 plus have rolled up their sleeves and boosted their protection against COVID by getting a 3rd jab. Now this equates to 48% of the eligible population boosted, and exactly 113,738 Tasmanians having received their booster shot. Sorry, I'll say that number again, 113,738 Tasmanians, I should say, having received their booster shot. Now, it's fantastic to see the enthusiasm for boosters, and I'd like to encourage everyone to please book now and attend for your booster shot.
What's the plan for staffing that City Hall facility that needs to be used?
So we currently have staffing that is available for outpatient appointments that we're conducting in our COVID-19 ward space at K Block. So it will require staff to actually shift over, and we've made plans for that should that be required. But at the moment we are comfortably attending to outpatients in K Block.
Do you have a... Sorry.
If this was planned all along, why didn't you tell us earlier?
So we have actually, we move outpatient clinic spaces, in fact, all of the time. So we've moved, for example, within hospitals, as we go through our escalation levels of our pandemic plan, we will shift and move. So for example, with our standing up of external triage areas outside of the ED, we've made an announcement as we're about to erect those ED areas so that the public is informed and understand what to do. So we're just giving forewarning in terms of the City Hall outpatient respiratory area. We're not currently using it, so please don't turn up to the City Hall today or tomorrow as a COVID positive, and we'll manage carefully when we need to move to the City Hall to get that public information out. But at the moment, all COVID positive outpatients are being handled at the Royal.
How close are we to needing that facility? I mean, how many more beds in the ward are there that could be filled before we'd actually have to move across there?
So it is a matter of actually the more efficient use of our ward spaces. So we have several ward spaces that are going to be available to COVID if it is needed. So in addition to ward spaces that we have in K Block, we've stood up additional space, for example, in the A Block, so Ward 2A, which is currently being used for general medical patients at the moment. So we will shift ward spaces, and running an outpatient clinic within a ward space is generally not what is done. Outpatient clinics are usually held, in various areas of the hospital for paediatrics or for other specialties. But with low numbers of COVID patients that are actually currently admitted, it was more efficient to just do those outpatients within that ward, noting all of the special precautions to protect the hospital. But
we expect us to be using it within the next month or within the next week or so?
So our inpatients at the Royal have stayed pretty steady over the last week or so. We have obviously sitting at 20 patients at the Royal today, and we will look to see in terms of if we're pushing up, for example, to the 25 to 30, I think then that's when we'll make a move on our outpatient clinic and make sure then that that ward is fully available before we open up another whole COVID ward for the hospital. But on current numbers, it's been relatively steady.
Are you aware, you've also talked about the Mersey, but is there any more awareness of any transmission inside the state's hospitals?
No, I'm not aware. So the Mersey, and we've commented, I think, at every single COVID update that there has been no detected transmission within the hospital. So the Mersey is the first where we have detected transmission. We have investigated a few where we have had staff members, for example, reporting as positive. We do full contact tracing around each of those events.
The nurses didn't believe that it has the North West Regional Hospital ceased oncology and colonoscopy services as part of escalation plans?
So in terms of oncology, certainly I'm not aware of any cessation at that hospital, but in terms of either moving or shifting patients' appointments for various specialties, that is currently occurring in the state as we manage various levels of escalation.
Was there quite a drop in the number of Tasmanians seeking PCR testing after we started accepting rapid antigen tests?
Yes, we have seen a corresponding decrease in PCR testing, which is why it's important to really confirm that PCR has not stopped. We have not swapped PCR for rapid antigen testing. However, I think the public are embracing the efficiency and with the availability through the state of the RATs for close contact and symptomatic people, that's where a lot of the population have shifted. But I really do want to emphasise, particularly for whether it's the elderly or whether you're just not comfortable in terms of actually performing a rapid antigen test, having performed quite a few on my own household, which includes a 92-year-old, that if you do wish to use PCR, please do book that in, because then it's done for you. You don't have any concerns in terms of interpreting test results.
And the clinics at my state arena and the Silver Diamond, do you anticipate you'll keep those open for the foreseeable future?
So we are going to transition from the large mass sites back to our testing clinic sites given the demand at the moment, and we're managing probably close to 5,000 requests across the state for rapid antigen tests per day over the last few days. So those are being comfortably managed at our testing site clinics with the rapid pick-up and delivery service.
Do you want me to deal with that matter of exemptions? My understanding is there have been 59 businesses that have requested exemptions. I'll get to the right number, but I think it's around 268 from memory. Just bear with me. Yeah, 268 workers exemptions have been requested for. That's so 59 businesses, 268 workers across agriculture, aquaculture, manufacturing, freight and logistics. We provided around 1,550 RATs to those businesses as part of the program. So,
eased some concerns so far about supply chains and other operations?
well, look, one of the points I made last week, a lot of the supply chain interruption was being felt on the mainland in those major distribution centres. We hadn't started to see significant issues here in Tasmania. I will say this, I was a little surprised in terms of the low number of requests for exemptions. On Friday when we opened, I think we had 15 requests for exemption. On the weekend, and that lifted to 39, and to where we now have 59 businesses that have requested exemptions. I think what a lot of businesses are finding is that with the 7-day isolation period, it's rolling over relatively quickly, but in terms of those key areas, as I've said, manufacturing, freight, logistics, agriculture, aquaculture, 59 businesses across those sectors at the moment.
Premier, people are requesting a RAT, who are requesting a RAT online, say they're being told to wait up to 3 days. They are waiting up to 3 days for a test to be delivered. Is there any reason they can't be delivered sooner?
Well, look, that surprises me. I don't know if Catherine Morgan-Wicks might have a view on that. My understanding is that we were dispatching them within 24 hours.
Unions are calling for free RAT tests for workers. Would the government be willing to allocate any of its stash to high-risk sectors as demand keeps up and keeps growing?
Well, I think a couple of things will happen here. One is that the initial supply constraints on rapid antigen tests over the next couple of weeks in the broader market are going to be reduced dramatically. And in terms of businesses, there is no pre-requirement for them to rapid antigen test unless they are part of the exemption process. Now, in terms of those businesses, we have said that we'll provide supply for the next 2 weeks, and for each business that makes an application, they will receive sufficient rapid antigen tests for those workers that they have requested an exemption on. Look, we'll keep it under review, but at the moment I don't think that there will be a supply constraint for business across the board.
Just on the education, and you're talking about the education plan, does the government have a way of ensuring independent and Catholic schools are acting in a COVID-safe way and are developing plans like the education departments? Are you concerned you could see an outbreak there?
Well, obviously those independent schools will all have a COVID-safe plan in the same way that public schools do. And in fact, they have been operating with COVID-safe plans in place now over the last 18 months. So in terms of Catholic and independent schools, I'd expect that they would take on board the same measures that we'll announce in our plan later this week. And if they require some assistance, then we'll provide some assistance to them.
Do you expect that, you were talking before about transitioning to living with COVID, do you expect that we'll be at that point where we remove things like mask rules before winter?
Before, sorry?
Winter?
Well, again, and that'll be a matter for public health to make the decision on and provide advice. I'd make this point, and in terms of the opening of our borders, last couple of years we've had two key ways to manage COVID. That was lockouts or lockdowns. Now, vaccination puts us in a completely different position. And importantly, the best time to deal with a respiratory disease is over summer, rather than on the cusp of winter, which some that have been calling for borders to be locked would have actually driven us to a point, if borders had remained locked, where we would have been opening up on the cusp of winter when respiratory diseases are worse. But in terms of masks, in terms of the step down from other public health measures, that'll be based on advice from public health. But I would hope that we could transition through this period to living with COVID over the next couple of months.
New South Wales is looking at testing students up to twice a week. Is that something that you would consider implementing here?
Look, I'm not going to be drawn on what measures might or might not be in our education plan, other than to say that at the end of the week we'll provide clarity in terms of the steps that we will take. Now, I would expect that in terms of the provision of rapid antigen tests to parents, that is certainly something that we will do. What that number will be and how we'd expect them to use them will be based on public health advice.
And should Tasmanians be concerned that using City Hall means that there isn't capacity in our health system to manage COVID?
Well, look, I've been quite bemused by the media take on all of this. This is a long-standing provision. It was used with swine flu back in 2009. We're actually announcing that it's been set up to be used. It's not being used at the moment, and so this interest in why haven't you said something about it earlier? We're actually saying it now before it's actually needed to be used, and that it's in place. And as I've said, it's been part of the broader pandemic plan now over the last more than a decade.
Regarding City Hall, is there a chance that you look to expand that up north to Launceston and Burnie? Is there provisions in place up there to have something similar?
Well, at this stage, we aren't looking at that expansion. We believe that we've got space within our facilities, but if we needed to, then obviously we would. But again, the point that I would make, and whilst we will see hospital admissions increase, that is a given. We will see some people get seriously ill, and as I've said, unfortunately, we will see some people die as a result of this. At the moment, we are managing well within the bounds of the initial modelling that we looked at. And as I've said in this space, but certainly in the other room that we've met, we have capacity within our hospital system for more than 400 hospital beds at its peak. Around 113 ICU settings available should we require them. Our health system is very well set up, it's very well prepared, but at the moment we are seeing a very low level of hospitalisation, and at the moment, unfortunately, we do have 2 people in ICU and 1 on a ventilator, but we are managing well within the plan that we set.
How do you think the Ashes went broadly? Were you happy with how everything ran?
Well, I received contact from some friends of mine that live on the other side of the world to say, one, they can understand why I live in such a beautiful place after looking at the shots of the River Derwent and Bellerive Oval, Blunston Arena on Friday and Saturday nights. I think what it's done is actually opened the eyes of the world to Tasmania. I'm very pleased in terms of the fact that Australia gave the Poms a thumping. I said in last week that when in answer to the question, what will be important in terms of whether or not we get another Ashes test, well, having Australia win the Ashes test here, I think is a pretty good box to tick as a starting point. So look, I was very pleased in terms of the behaviours of people over the weekend at the Ashes test. I travelled the ground on a number of occasions from the hill to the corporate areas to the stands. And in the main, the vast majority of people were doing the right thing, and I was very pleased with that.
Were you surprised by crowd figures? None of the days ticked 10,000. It looked quite full most days. Were you surprised by the attendance figures? Or were you happy with them? Did you think that maybe there were a little bit more than what reported? Well,
look, I'm on the same page as Andrew Gagan, the chair of Cricket Tasmania. I've asked for a review of those numbers. I have, let's say, first. Like him, I was very surprised. I've been at Blunston Arena watching football matches with crowds of 7,000 to 8,000 people, and I can assure you that the crowd that was there on the weekend felt at least a couple of thousand people more than what was being reported. So it did surprise me, and I think you've made the point yourself that the ground looked well populated with people, and it did surprise me, those cricket numbers.
Just on the Derwent ferry service, any plans to expand that to include trips from Kingston to town?
Look, absolutely, I want to see that expanded. I think that the Derwent provides a a highway through the city, to be frank, and it's an opportunity to look at. The trial has been very successful, and we will extend that past the 12 months. We'll be engaging with the 4 mayors to discuss with them what options they would like to see, and importantly, I think, what contribution they might make. You know, if you think about public transport, we provide the metro service, but councils provide the bus stops. You know, I'd like to see some co-investment in terms of stops in a range of different areas up and down the river, because I think what the weekend has demonstrated, and in fact the trial up to the weekend has demonstrated, is that people will use ferries on the river if we can make it accessible for them.
I think it should be permanent.
Sorry?
Do you think it should be permanent?
Absolutely. Look, we'll be extending past the 12 months. I think that the trial to date has demonstrated that the ferry service to Bellerive has been a cracker. It's been very successful, and I think the event on the weekend demonstrated that people are voting with their feet in terms of it. So we'll be working with the 4 mayors to have a discussion with them about what options we can put in place, and I'd certainly like to see the ferry service extended.
How are you doing?